Okay, hi everyone. Welcome to our second to the last briefing. As you may recall, we indicated that we're going to end these briefings with the elected officials and with all of you in the first week of May. So we will conduct one more after this as we then move to the opening of society on June 15th, the remainder of society, and getting rid of those tier systems. And we'll see what that brings. But thank you for being here with us today. And I'll jump right into this and try to get through it quickly to see if you have any questions. Sorry to report, we have 5 more deaths to report to all of you. And I had hoped to get through a month period without a death report, but that is unfortunately not the case. In the last 2 weeks, we've had 5 COVID-related deaths, and I think all wonder when will be that last death related to COVID. 42,000 plus confirmed cases, 8 hospitalizations to date, which is, I think, the lowest amount that we've had in a long, long time. So that is very good news, and let's hope it continues to trend in that direction. We are currently second in the state in testing, 745 tests per 100,000. And again, that's something that we had maintained as a priority throughout for a variety of reasons, the variance, the impact on the adjusted case rate, so on. So we will continue that in a host of locations around the county, pretty much in every region and in most cities we have testing. As you all will recall, the current tier changes were determined based on the data from May 9th and through the May 15th. Being in the yellow tier now and continue where we are with our continuation of where we are with our statistics, I'll reveal in a minute, pretty much guarantees us that we will remain in this tier until the tier system goes away on June 15th. So that is good news. It does not look like we will revert back. So as of today, the adjusted case rate is 1 per 100,000, which puts us well under the two required to be in the yellow tier. And you think back to January, we were at 36.3 on the adjusted case rate. The unadjusted case rate today is 2 per 100,000. Contrast that with January 19th, of 2021, where we were at 62.9. I mean, it's just hard to believe that we've come that far in such a short period of time. Positivity rate is at 0.3%, and the health equity metric is now at 0.7, which is great. It continues to trend down, and contrast that with January of 21, where we're at 14.1%. Unbelievable progress in a relatively short period of time. So moving beyond the blueprint to safer economy, these are the things that we know will take place in the near future. And that's really the sectors listed in the current blueprint activities in the business tiers chart are expected to return to usual operations. So there will no longer be capacity limits and physical distancing requirements for businesses. The state will also align our mask and travel rules with the federal government on June 15th. Until then, the state's current face covering guidance applies in our county. So vaccinated people do not have to wear a mask outdoors except in crowds, and unvaccinated people should wear a mask when physical distancing can't be accomplished. So the only restrictions under the new state guidelines will be for large mega events, and those defined as crowds greater than 5,000 indoors and 10,000 outdoors. And for those events, the state recommends that event operators have a system to verify patrons are either vaccinated or test negative. The employee side, which is somewhat of certainly a concern to us, we're still waiting on some more updated information on that. So we'll see Cal OSHA their board meets on June 3rd. We hope to get updated information on that so we can certainly apply that to not only our own operations here, but businesses throughout this county. So more to come on that in the near future. Some vaccination updates for you. Moderna is expected to submit the request to the FDA for approval of 12 to 17-year-olds in early June. So we look forward to that. Additionally, Pfizer vaccine can now be stored for 1 month at refrigerator temperatures, which will certainly allow for greater flexibility even in pediatricians' offices if that was something that they desired to do. So a lot more flexibility in regard to the vaccine and the way it is stored. We are also moving to predictable vaccine clinics each week at each of the SMMC sites throughout the county, as well as East Palo Alto. So we'll continue to facilitate and expand micro-targeted vaccination events. The supply is no longer an issue. We have enough supply, of course, to take care of everyone's needs. Now it's a matter of getting people to the vaccine sites. So as of the 24th, the data shows that we've almost vaccinated, almost issued a million doses, 921,000. It's about 82.6% of the eligible adults 16 plus. And we also see that we've reached 68.7 eligible adults in our lowest HPI index census tracts, a 13.9% percentage gap, which we will continue to work on. And that is something that's very important to us and something that we are absolutely committed to. We've reached 79.6% of our 12 plus population, 32% of the 12 to 15 year olds are already vaccinated with their first dose. So we can see from the data dashboard that 120,000 plus residents 65 and older have been vaccinated so far, and 77.4 residents of 75 and older have been vaccinated. So these percentages went down when we started using our new population denominators last week, and there's a lot of information in there that we're still working on and will continue to update. The San Mateo Medical Center continues to issue doses of the vaccine, and they're certainly being administered at our local clinics also. So HR support continues, weekly clinics at the hospital, Daly City, and Fair Oaks Health Center. And then today marks the last day of our first dose mass vaccination. So we'll be decommissioning the event center after today, and we will no longer have first dose mass vaccinations. We believe that there's an abundance of supply, whether it be pharmacies or clinics or the community events that we are doing to take care of the rest of the population as we really strive to get over 90% here in this county. It's something that we're very focused on, and we will continue to be focused on for the upcoming months. But we do want to point out that we will continue in our low HPI areas, and we will be making sure that we do the micro clinics, and we'll really be opening up a site on our webpage for community leaders or businesses or churches who want to have a micro clinic to fill out a form, and we will try to get to them in a more mobile vaccination way. Now, second doses will continue. The second mass vaccination doses, of course, will continue. We'll be moving those operations to the SFO site, which is a great location also to accommodate those second dose mass vaccinations. We have those going on almost every day now. And we will continue with those at those sites. It also helps us to accommodate the county fair, which is coming in to the event center there. So the federal pharmacy partnerships updated information available on 5/21 for a total of 60 pharmacies in San Mateo County. Now you can understand why we're kind of decommissioning those large first dose vaccinations. We have 20 brick and mortar CVS pharmacies, 7 Rite Aid pharmacies, 16 Walgreens, 4 Costco, 7 Safeways. So it's really everywhere. The vaccine is everywhere if you need it. And as I indicated before, we will also be really focusing on the micro level in neighborhoods. We're also looking at a strategy for the county fair, and we'll most likely have a vaccine out there, hopefully every day or close to every day. And we are looking at some kind of incentive program, whether it be free admission or a giveaway of fair dollars to buy meals and fair tickets for anyone's vaccinated. So we're working on that program, and we should have more information on that in the near future. The Emergency Rental Assistance Program, ERAP, continues along. We've got some more applications. Total rent requests so far are 24.3 million, comprised of total rent requests of 23.05 million and total utilities requests of 1.28 million. So we are certainly underscribed at this point in time. We've got a lot of money available for this program. We know from the state that there's potential for up to 10,000 people that may be behind in their rent and in jeopardy of losing their housing. So we really want to get the word out there and let them know that there is a path forward. Not only can the renters apply for this, but landlords can apply for this also. And we're hoping to see what the changes are in the near future to SB 91. We're waiting for updates. And examples of that may be reducing the length of the application, which is somewhat arduous, but we put a great deal of money into funding our nonprofits who will help with that process for anyone. And right now they're undersubscribed also. So we got to make sure that we direct people to those nonprofits in a way that we can help them. So we're really working on ways to try to reduce that application length with the state. Also working on ways to help with renters with shadow debt. So we hope that we see some information on that in the near future, which will allow us to get more people into the process. Operation or Project Room Key continues. Our shelters are filling up. The Pacific Shelter, I believe, is now full. Coastside Shelter is getting there. And we're also using temporary shelter rooms throughout the county, while also seeking other potential purchases of hotels to use as long-term transitional housing for those experiencing homelessness, so we can get them off the street on their way to permanent housing. So more to come on that. Great Plates continues to be an incredible program. We now know that funding has been confirmed through June 7th. We'll see what happens to that after that. We will act as a backstop if it does end on June 7th till at least the end of the month. Almost over 2.5 million meals served. We're still out there giving masks out. We're still looking for trusted community members to give testimonials via videotape, which we've got some great ones out there that we've put forward with trusted community members to get the hard to reach community members or those on the fence to go ahead and get the vaccine at one of the many sites that we now have. So with that, let me stop there and just say, look, we've enjoyed this partnership, you guys getting the information out there. And we've been at this for almost 15 months now. We look forward to the next one, which will be the last one on, what was that date again, Connie?
June 9th.
June 9th. So just in front of the expected dissolving of the tiered system on June 15th. We will be giving our final briefing on June 9th. And with that, let's see if there's any questions.
Yeah, why don't we start with Henrietta?
Henrietta, I'm going to miss hearing your voice after our next session together.
Thanks so much, Mike. I'm going to miss attending the informative sessions you've been giving. with all of the progress being made, I'm wondering, what about the contract tracing programs and the testing sites and programs? What will happen to them?
Yeah, all that remains really an important part of what we do, and we will expect to keep those intact. The testing is particularly important because it's important for us to make sure that we keep track of the variants, and that we certainly contact those that have been around somebody that's positive to make sure that they're aware that they've been in contact with somebody who is has tested positive. So that will remain in place. And the other part, Shrija, if you have a question, or if you have any more to add to that.
Yeah, Henrietta, contact tracing remains just a core important public health tool. As you know, we're striving to get to every eligible resident being vaccinated, but as there are cases, we've seen over the course of these last many months, the capacity for someone to get contacted very quickly and get good advice about how to safely isolate or quarantine, how to protect themselves and their family members has been super important, as with other transmissible diseases. So it's a really important part of the core public health continued strategy as we keep marching forward.
And Henry, I gotta say, it's also been nice. You know, we've had many of our employees that have been redirected to contact tracing. With the numbers dropping, we're getting those folks back into their regular assignments. And I gotta say that the feedback that we're getting is that they found it very rewarding to be in that process, contacting people and letting them know, and they felt like they were really playing a major part of fighting against COVID-19. And they really welcomed that experience, and we're great ambassadors for this county and that conduit to very important information, which certainly those folks appreciated. See anything else?
This looks like Sarah Wright has a question.
Sarah.
Hi, thank you both for all your work this past year. What is the county doing to sort of look back or analyze its work during this pandemic and assess its ability to meet this huge challenge? Is there any type of like post-mortem in the works on how county health has handled COVID?
Yeah, that's a great question, Sarah. We absolutely will avail ourselves of that opportunity to look back and really see areas that we can improve upon. I think that we did a ton of things right, and we're the leaders in so many different things. And of course, there's no map, there's no guide on how to get through a pandemic. But I think that we had just incredible, hardworking people who have done just a tremendous job. But that doesn't mean we got everything right. And I'll be the first to tell you that we didn't. But we're going to use this experience and get better. I can tell you that we have grown exponentially through this last 15 months in ways that would have taken us 10 years had we not had this experience. I think that we're a closer county because of this, with all the collaboration that has been necessary. And that doesn't happen overnight. You know, that started long before COVID. And that's what I think is so unique about this county, is that we are known as being a collaborative county with the elected officials who worked hand in hand with us and side by side. And we're so cooperative. And all the employees in this organization who pivoted and wore hats that they could never imagine wearing, but they did so with determination and with in mind the need to provide services. So to those most in need during a major crisis that many of them, could have been affected by, playing those roles, especially our healthcare providers. But we will learn from this also, and we will look at the things that we could have done better. I have great concern about wildfire here in the near future, or a major earthquake, and we will be more prepared because of this experience. But we will definitely be looking back to see where we can improve.
Okay, I'll go to a question in the chat and then see where we're at. Given strong concerns for mounting rent debt and the need for more time to apply for assistance, are discussions happening at the county level around the potential to implement a local eviction moratorium if the state doesn't extend its moratorium? If so, is there a possibility that the ordinance would be countywide?
It's, it's a tricky area as far as countywide, because I don't believe the state of emergency would still be there that would allow us to do that. It's more of a legal question than anything else. For right now, I think the best path forward is to avail oneself of the tremendous funding that is out there. I mean, that debt will still be there unless people take the opportunity to avail themselves of this relief as we open up. The state may take that opportunity to extend the moratorium, and we believe that if they chose to do so, that would be the appropriate place. We would be very limited in our abilities to do something like that, I believe. And certainly I'm not speaking for the board, because it's really the board decision, not my decision. But we have so much money available to end that crushing debt that many people are under. That is where our focus needs to be, to try to eliminate that debt, to keep people in their residences, so that we can make sure that they don't end up experiencing homelessness and cause more stress on that part of the system. So the right thing for us to do is to ask everyone to really focus right now on trying to avail themselves of the money that is out there. And again, it's money that we lose if we don't use. So we are really focused on that right now. And we're asking our nonprofit partners and private partners and public partners to really help us get that word out, to get people signed up for this.
On a similar note, does the county plan to set up its own rent relief program with funding the American Rescue Plan Act?
Well, there's a tremendous amount of money left in this plan, and we're only, we got I think a request for $24 million, and we've got $76 million available. We can't leave 50 million on the table. We've got enough resources here to take care of the situation. And if we don't, obviously that is something that we would look at in the funding that we've received from ARP. But we believe that there's enough here. And our bigger problem is getting people to the table to sign up for it. And that's why we hope that the state looks at this and lowers some of the barriers that have been keeping people out of it, such as the length of the application, that 20% forgiveness may be causing landlords to be hesitant to get involved in this, hoping that that would be eliminated. So those are the things that we really look forward to addressing, hopefully at a state level.
And let's come back to Henrietta has another question.
Yes, thank you. I can't help but ask, as a follow-up to Sarah's question and your response, that the county hasn't done everything right. In case there is the threat right now, perhaps, of a surge, a COVID surge, would there be anything differently done by the county in case there is a surge?
Oh, you mean in case there's another surge in the near future?
Yes, in terms of the things that you would do differently. Would you do anything differently in if the county had to respond to a COVID-19 surge? Because
I would have to really, Henry, it's a good question, but I'd have to really understand where that surge is occurring. Is it in our congregate senior living facilities? Is it in a particular section of the county? Is it in our low HPI areas? Those type of things, I think that we would apply lessons learned from the past to address those. I just, generally speaking, I'm sure there's things that we could do better. I mean, these are, again, there was no path to this, no map, no guide. This has been a resilient crisis and COVID-19 has been resilient in so many different ways that we've had to pivot different times in different ways to address the needs of our community in San Mateo County. And I think we've done a great job of doing that, but I'm sure there's things that we could do better.
I would just add, Henrietta, that in terms of keeping our eye on, what is going on with the virus transmission, we're very much vigilant on the surveillance, sufficient testing, grateful for the public's continued availing themselves of testing, healthcare providers continuing to test, and that surveillance capacity being much stronger at this point than where we were 18 months ago. Case and contact investigation that we talked about, appreciate Sarah's coverage of that key tool. Isolation and quarantine support so that there aren't barriers for people who, if there was a travel related source or some other source, that we have the supports in place so people can isolate safely. The vaccine, and trying to get to every single resident who's eligible to keep protecting all of us. And all the other supports that have been mobilized, recognizing the disproportionate risk that some communities have borne. Those capacities remain in place to help us continue to mitigate the spread as we continue to make progress on the vaccine.
But Henrietta, to be specific with you, as I sit here and was thinking about it, I'll give you an example of some of the things that, lessons learned was on the PPE. I think that, we thought certainly we had enough PPE, but we could never imagine that we would go through it so quickly and that we would then be in competition with the entire world for a limited supply of PPE that wasn't in this country. And it put us in a vulnerable position like every other provider throughout the United States and throughout the world. That was a lesson learned that, we never want to be in that position again. And, we're committed to having enough PPE to address any situation that we come into in the near future. So it's something that those are the type of things, in making sure that we have supplies and supply chains lined up to address those type of things is just so important. But
Mike had the opportunity yesterday to thank the hospital CEOs of every hospital serving San Mateo County, and every facility. Our healthcare coalition partners have shown such tremendous capacity to pivot and adapt and jump quickly on the key roles they play. The winter was really brutal for so many residents who lost a loved one, for so many residents who knew somebody who became very sick. And sadly, from what we experienced, we have continued to get better at what does it take to really mobilize the capacity that's needed most in the places that it's needed most, safely, trustfully.
Thank you.
Okay, anything else?
We had one follow-up question. To clarify, could the county use funds from the American Rescue Plan to fill in that 20% rent debt landlords are being asked to cover to encourage more participation?
The answer to that is I don't know. That the ARP continues to evolve almost daily on things that are allowed and disallowed. And as I sit here today, I don't know where that if that would be allowed or not. I'd have to do some research on that.
And those are all the questions at this time.
Okay, listen, I really appreciate everyone being here with us today, and we look forward to seeing you on our last briefing on June 9th. Until then, everyone stay safe.